Hi, welcome to OET4U. Today we are going to discuss about the case note of John Adams, which is available in our website oet4u.blogspot.com. Okay, so you can visit the website and see the case note, and the link is already available in our groups. So you can uh, write letter and send free to paste in our WhatsApp group and Telegram channel if you likes to have a review of that. Okay, so today we are going to discuss about this letter, how we are going to write a letter based on this case note. And this is a general model question paper for both for medicines and for nursing, whatever it, because it's a follow-up care referral letter for Dr. Laura Perkins. Let's see how the question is looks like. Okay, so writing task. Using the information below, write a letter to Dr. Laura Perkins, general practitioner at Health First Medical Center, requesting follow care for Mr. John Adams after his hospital admission. Include the relevant medical history, treatment provided, and any ongoing care requirements. Okay, so this is actually the writing task that is already given here. So you can see we are writing to, we got a letter for Dr. Laura Perkins. Yep, that's the patient's, the recipient's name. So we can use that information, and the address is given at Health First Medical Center. Okay, so why we are writing the letter, what is the purpose of the letter? It is clearly given in the case note in the beginning itself, that requesting a follow-up care for Mr. John Adams. So it says that Mr. John Adams is our patient. So what happened to him? That is our next question. Okay, so you should think every second, because the writing test for OET exam is about 45 minutes. So for that, the first 5 minutes is just for reading, so you can't touch your pen or pencil on during that time. So let's utilize that time and plan your letter very well. So this is the only thing you can do on that time. So you have to write your case note carefully and understand what is actual purpose of the letter and how you're going to write the letter, and plan your first paragraph, second paragraph, and so on. So here it says that requesting follow-up care for Mr. John Adams after his hospital admission. So from this information that he got few bits about the patient itself, the patient had a hospital admission, and so in that letter you should include relevant medical history, treatment provided, and any ongoing care requirements. So that you have to include these three important informations in your letter. Okay, so let's see what we can see detail about this patient. Okay, so next one is patient details given. John Adams, 67 years, address is given. So medical history, so diagnosed with an abdominal aortic aneurysm 3 months ago, routine checkup. Okay, smoker for 30 years, ceased smoking post diagnosis. That means patient stopped smoking before 3 months ago. It's just 3 months ago. Okay, so patient got other conditions like hypertension managed with Ramipur 5 milligram per day, and type 2 diabetes is controlled through diet. Social history: lives alone, limited mobility, daughter visits twice a week. So admission details is date of admission is 12th January, okay, 2025, on emergency. So presenting compliant while on admission, sudden onset of severe abdominal pain radiating to the back of radiating to the back. Okay, so that's radiating to the back. That's good. All right. So presenting compliant. What is presenting compliant? Onset of severe abdominal pain radiating to the back. Okay, the diagnosis is ruptured abdominal aortic aneurysm. So this is the actual patient's diagnosis during admission. Sorry. Okay, so management: emergency open surgical repair performed, ICU stay for 3 days, transformed to the general ward 15 January 2025, discharge planned on 19th January 2025. Okay, so that's the date is very important, because when you are planning to write a letter like this, the date is also important. The date of the letter is when you are writing letter is on today. If you're going to write the exam, so that means today's date is 19 January 2025. Okay, so hospital progress is given, so you have to read that carefully. A post-operative recovery uneventful, wound healing well, staples intact, blood pressure stabilized, average blood pressure is 138 mmHg, and blood glucose levels monitored, it is stable. Discharge plan: so pain management, paracetamol, and wound care dressing changes every 3 days, follow up with vascular surgeon in 6 weeks, physiotherapy referral for mobility improvement, encourage smoking cessation counseling. So special notes. Okay, so monitor for signs of infection or complications, example fever, redness around the wound, reinforce diabetes management strategies to prevent complications. So these all are the instructions to the doctor. So we are writing a letter of follow for a referral letter for follow-up care for Mr. John Adams. So how are you going to draft this letter? So the candidate instructions are given. The note use note form as usual. Ensure letter in between 180 to 200 words. You should address the letter to Dr. Laura Perkins. The address is already given in the beginning of this case note. So kindly welcome all of your letters in the groups, and you can post that letters uh, in our WhatsApp group and Telegram group and Telegram channel as well. And feel free to write the letter, and we will have a discussion of a sample letter soon, and how we are going to draft the letter after your letter, one of two letters published in the group. Thank you for once again just waiting for your queries and your letters soon in the group. Thank you.